Fix Your Ball Problem, the ultimate guide to testicular health for men. This is written in a natural conversational tone, suitable for an educational long-form YouTube video. It covers causes, symptoms, solutions, and prevention strategies for testicular health issues in men, particularly those over 40. Intro. Hey there, gentlemen. Let's talk about something most men avoid, until it becomes a real problem. Yes, we're talking about your balls, testicles, crown jewels, whatever name you prefer. If you're over 40, chances are you've noticed changes down there. Maybe they sag more. Maybe they itch. Maybe they're uncomfortable, painful, or just different. But here's the truth. Ignoring testicular health can lead to bigger problems. Today, we're going to fix that. In this video, we're diving deep into everything you need to know about testicular health, how to spot issues early, how to relieve discomfort, and how to keep your masculinity thriving as you age. So sit back, relax, but not too much, and let's fix your ball problem, naturally, confidently, and permanently. Part 1. Understanding your testicles. Before we fix anything, let's understand what we're dealing with. Your testicles are oval-shaped glands located in your scrotum. Their main jobs? Produce sperm. Make testosterone, the hormone that fuels your libido, muscle mass, energy, and mood. But here's the kicker. These small organs are incredibly sensitive, physically and hormonally. And as you age, they face wear and tear just like the rest of your body. Part 2. Common testicular problems in men. Let's break down some of the most common ball problems that affect men, especially over 40. 1. Sagging testicles. Gravity plus age equals sag. The scrotum loses elasticity with time. It's totally normal, but excessive sagging could mean weak pelvic floor muscles. 2. Itching or rashes. This could be jock itch, a fungal infection, heat rash from tight clothing, poor hygiene or excessive moisture. 3. Pain or swelling. Could be epididymitis, inflammation of the sperm-carrying tube, varicocele, enlarged veins, hernia, a bulge from intestine pushing into scrotum. Testicular torsion, a medical emergency. 4. Testicular lumps. Lumps should never be ignored. Some are harmless cysts. Others may indicate testicular cancer. Always get checked. 5. Low testosterone. Your testicles produce less testosterone after age 30, about 1% less per year. That means lower sex drive, less muscle mass, more fat, brain fog, mood swings. Part 3. How to prevent and fix testicular issues. Now let's get to the part that matters most, solutions. 1. Wear the right underwear. Switch to supportive boxer briefs. Tight boxers equals sweating and irritation. Clean the area daily with gentle soap. After a shower, dry thoroughly. Moisture breeds bacteria and fungus. Use talc-free powder to reduce sweating, especially in warm climates. 3. Do Kegel exercises. Kegels aren't just for women. They help lift and tone pelvic muscles, support testicles, prevent leakage, improve sexual performance. How to do it. Squeeze as if you're stopping urine midstream. Hold for 5 seconds. Release. Do 10 reps 3 times a day. 4. Improve blood flow. Poor circulation equals testicular pain and swelling. Fix it with cold showers. Regular walking or stretching. Avoiding long hours sitting. Take breaks every hour. 5. Eat for testosterone. Boost your hormones naturally. Best foods? Eggs. Cholesterol helps make testosterone. Tuna and salmon. Vitamin D. Leafy greens. Magnesium. Pumpkin seeds and oysters. Zinc. Pomegranate. Improves sperm quality. Avoid alcohol. Reduces testosterone. Soy and processed sugar can mimic estrogen. 6. Reduce heat exposure. Avoid hot tubs, laptops on lap, and tight jeans, all of which overheat the testicles and reduce sperm production. 7. Self-exams and checkups. Every man should know how his testicles normally feel. Once a month, gently roll each testicle between your fingers. Look for lumps, pain, size changes. If anything feels off, don't wait. See a doctor. 8. Stay sexually active. Yes, seriously. Ejaculation helps flush the system, keeps your prostate and testicles healthy, and maintains hormonal balance. But don't overdo it. Balance is key. Part 4. Natural supplements that may help. If you're looking for natural support, consider these. Ashwagandha boosts testosterone and reduces stress. Zinc, critical for sperm production. Vitamin D3 supports hormone levels. Fenugreek may improve libido. Saw palmetto, DHT blocker that supports prostate and testicular health. Always check with your doctor before starting supplements. Part 5. When to see a doctor. Red flags you should never ignore. Sudden severe testicular pain. Swelling that lasts more than a few days. Hard lumps or uneven texture. Pain when urinating. Blood in semen or urine. These might point to infections, torsion, or cancer, all of which require immediate attention. Final thoughts. Fix your ball problem, fix your confidence. Let's be real. A man's confidence is deeply connected to how he feels down there. But times are changing. Caring for your testicles is not just about sex. It's about longevity, hormones, energy, fertility, and mental strength. So take action today. Fix your lifestyle, do your exercises, eat better, stay alert to changes, and most of all, don't be ashamed to take care of yourself. You only get one set. Treat them right. Outro. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with a brother, friend, or dad who needs to hear it. Comment below if you've experienced any of these issues and what worked for you. Let's break the silence on men's health. Subscribe for more videos on natural men's health, aging with strength, and living your best life after 40. See you in the next video.